As the country battles a second wave of coronavirus cases, the state of Nevada launches Stay at Home 2.0. Plus, Governor Steve Sisolak tests positive for COVID-19. In Las Vegas, Eagle News correspondent Lory Jarvina has the details. Lory?
Thank you, Anna. During a press conference this past Tuesday, Governor Steve Sisolak sent a strong message to Nevadans that if the COVID-19 data doesn't improve in the next 2 weeks, he will be forced to take more drastic action. For now, he is asking Nevadans to voluntarily stay home for the next 2 weeks. Under what Sisolak is calling Stay at Home 2.0, residents are encouraged to limit going out in public to do non-essential activities, including having get-togethers with those outside of their household. He recommends ordering groceries or picking up food curbside instead of indoor dining. Employers are also being asked to allow employees to work from home for the next 2 weeks and hold meetings virtually if possible. COVID-19 cases in Nevada have been on the rise, with a record 1,906 new cases reported in a single day yesterday, with an average of 1,214 daily over the past 2 weeks. Hospitalizations are increasing, but staying within capacity at this time. Here in Clark County, the cumulative test positivity rate within a 14-day period is at 11.1% from this past Monday, compared to 9.2% 2 weeks ago, and case rate per 100,000 is 701 compared to 490 2 weeks ago. If this trend does not improve, Sisolak threatens to once again enforce restrictions, but no details of that plan was specified. He stated, and I quote, "For the next 2 weeks, we must mimic our stay-at-home behaviors from this past spring. If we do so, we believe we can begin to turn around things in 2 weeks without having to place increased restrictions on our businesses or our schools." Then on Friday, just a few days after the announcement of Stay at Home 2.0, the governor himself took a routine COVID-19 test, which provided a positive result. So Governor Sisolak wanted to inform Nevadans immediately of his status, emphasizing the urgency of necessary precautions for the state. According to Governor Sisolak, the only symptoms he has experienced is fatigue, which might also be attributed to his demanding schedule. This is another warning of positive COVID testing, but an example of an asymptomatic individual who shows little to no signs of actually having this virus. On a positive note, the city of Las Vegas is launching additional community-based COVID-19 testing sites, which are scheduled to open beginning Tuesday, November 17th. The first site is at Doolittle Senior Center and will be open November 17th. In addition, a site at Veterans Tribute Career and Technical Academy is scheduled to be open November 19th through the 20th. Also, a site at Centennial High School will be open December 3rd and 4th. The times for each location varies to accommodate for mornings starting at 8 a.m. until evenings until 5 p.m. These sites will be open to the public, and tests will be administered on a first-come, first-served basis. Testing is recommended for both symptomatic and asymptomatic individuals. The Southern Nevada Health District, the Nevada National Guard, Guardian Elite Medical Services, and American Medical Response are operating these sites in partnership with the City of Las Vegas and Clark County. It's not surprising to see the rise in numbers, as medical experts state health officials have warned due to COVID fatigue. People are growing tired of wearing masks and social distancing. Add to that the change in weather. We're in the fall now, and people are staying more indoors. And all of these are driving the surge in cases. Nevada Governor Sisolak's recent diagnosis is a case in point to not let ourselves become complacent as we face COVID-19 surges here in Nevada and throughout the country. We can't let our guard down, so please stay safe out there and keep those masks on. In Las Vegas, Nevada, Lory Jarvina, Eagle News. We live in interesting times. Back to you, Anna.
Thank you, Lory. You know, this lockdown due to the pandemic it's definitely something that we don't want to see a version 2 of, right? So how do you feel about the Stay at Home 2.0?
Well, actually, Anna, since we've had lockdown, we basically continue doing the same thing, which is ordering groceries online, having them delivered, and only curbside pickup for restaurants or takeout food. So this 2.0, personally, it's not going to change how our family is attacking this virus and doing our part. And like what was mentioned earlier, if everyone got on board and took this as seriously as our leaders want us to take it, then we should definitely continue doing our part. And 2.0, I'm on board. Let's do it. Let's get this pandemic over as soon as possible.
Absolutely, especially right now with Thanksgiving around the corner. I hear people talking about plans. It's actually been half and half. What about you? What have you heard anything from those in your circle, maybe from work? What are their plans?
Well, for like Thanksgiving coming up, our in-laws just live 10 minutes away or so, so they'll be coming over, and that's it. And in fact, those are the only other people we see outside of our immediate household. So those are plans to look forward to, but definitely still taking precautions.
Yes, absolutely, and stay safe. Well, we wish Governor Steve Sisolak the best. Hopefully he stays asymptomatic besides feeling fatigue, and hopefully he feels better. Thank you, Lory, for your report. Pleasure to have you on.
Thank you, Anna.